Hi everyone, I'm Mima Gear. I hope you all can hear me okay. If you could post a comment below just letting me know that I'm coming through okay and you can hear what I'm saying. Um, I can see a couple of people are watching, so I'd love to know if you can hear me. Hi everyone, I am Mima Gear. Can you hear me all right? I hope I'm coming through loud and clear. I'm doing this episode live and I'll be doing a series like this on education. And I'd hope this is interesting to you. And if you'd like to learn more about different areas of functional medicine, nutrition, just let me know what you'd be interested in hearing about, and I'd be happy to support you and your education. So this is a slightly long webinar today, and we're going to be talking about the thyroid. And I will be sharing a PowerPoint for those of you who would like to see this afterwards. If you're at work or you're not able to watch this right now, it's totally fine. It will be posted. But I wanted to also invite you to listen along and pop in whenever it makes sense for you to learn about the thyroid. So this is an area that is, I think, very important to pay attention to, that we're often not really addressing in Western conventional medicine. So I wanted to just bring this to everyone's attention because the thyroid is a very important gland, an endocrine gland in the body. And for those of you who don't know me, my name is Dr. Mima Gear. I am a medical doctor and also trained in nutrition, and I have a master's in nutrition. And so in my practice, I bring together medicine as well as nutrition, and I focus on an area called functional medicine. And so if you're not familiar with what functional medicine is, it's essentially an alternative form of medicine that's using a whole systems-based approach. So we're looking at root cause analysis. We're looking at what the root cause is of a disease when it shows up. And oftentimes people will come to see a functional medicine doctor when they're either exhausted of the capabilities of conventional medicine. In other words, they are sick and tired of the 10-minute visits. They're not feeling like they're getting enough attention, or they have tried different things in conventional medicine and that have failed them, or they just tend to have a more natural approach to most of how they look at their health, and this feels like a more natural fit for you. So if you fit into any one of those three categories, I'd encourage you to reach out to me or to other functional medicine providers that are doing work specifically in these areas. One of the main areas that we focus on include the thyroid. Okay, so if you wanted to learn more about me and my background, you can visit my website or you can find me on LinkedIn. So here are the topics that are really important when you're thinking about the thyroid gland that we're going to cover today. One is the actual physiology of the thyroid. So the thyroid gland itself, where it's located, how it works. We'll talk about the signs and symptoms of thyroid imbalance. So when something is off balance in the thyroid, what does that show up as in your body? What should you be thinking about? Sometimes I've had myself and other people that I've treated or that have been cases that I've looked at that have had very mild thyroid changes that show up as symptoms in the body, and you often don't know that it's the root cause, but you might have some inclination if you're familiar with this topic. So I'd encourage you to pay attention to that part when we go through the signs and symptoms. We'll also talk about how thyroid imbalances actually end up manifesting in the body. So what we want to always do with functional medicine and with looking at root cause analysis or holistic medicine is we want to think about diseases before they become a problem, right? So you want to start looking at whether or not something is going to be causing an imbalance further down the road, and start your treatment early. Start to make the lifestyle changes early. You'll often hear me talk about Ayurveda or early changes in lifestyle because they're so critical. When you start to make these early changes in your lifestyle, you can rebalance your body and then create change that is long lasting. Whereas when you wait until a disease fully manifests and shows up in an abnormal lab test that gets reported back to you, or you wait 5-10 years later, even beyond that, where it's slightly abnormal, you might be further down the line and more difficult to resolve that condition that's showing up. And it can be really challenging at that point to really face what's there. Okay, so I encourage you to be proactive with your health. If any of these things are resonating with you, reach out to somebody and try to get evaluated and see what you can do to become more balanced quicker when it comes to your health. You also want to check to make sure your thyroid hormones are in the right range. And we'll talk a little bit more about what that means. It's a little bit different when you're looking at optimal ranges, what makes you feel optimally healthy versus what actually is considered abnormal based on conventional lab testing. And so to do that, we'll talk about optimizing your thyroid hormones or thyroid results and how to naturally support your thyroid in addition to some of the treatments that are available. So again, the thyroid gland, you can see it right over here. It's this beautiful butterfly-shaped gland that sits right down at the base of your neck, right in front of the trachea. So you can feel your trachea, the hard part of the cartilage. It's a little soft gland that sits right in front of that area, and that's the thyroid. And so it's a very important endocrine gland in our body that I'll tell you more about. So you'll see all the different functions that it does. And when you notice, you want to always pay attention to what's happening in your neck area and make sure you're getting that evaluated regularly. So what does the thyroid produce? The thyroid essentially is using tyrosine that's synthesized by the body, as well as iodine that's coming in from the diet. And the epithelium in this gland actually traps the iodide from the bloodstream and links it with tyrosine. Okay, it then forms these two components here, and there are some enzymes involved that then split it up and release thyroid hormones, T2 and T4. Now remember, 90% of the body and the thyroid hormone in the body is going to appear in the form of T4. So really the majority of the hormone that we're evaluating when we're working with the thyroid is T4 that's secreted from the gland, but this T4 needs to then be converted to T3. So this is really important as part of the function and part of the reevaluations. I'm emphasizing this point to you because T3, that thyroid hormone, is 4 times more potent in its biological form than T4. And it's the major hormone that targets and directly interact with the cell. So what we call like end organ function. So it's when the T3 actually goes out into the cell and performs its function, that's when we know that your body is optimized in its thyroid hormones. So when we measure these different levels, we want to also make sure that we're checking the T3 and we're thinking about the conversion, the natural conversion between T4 and T3 when it comes to your thyroid hormone. So this is just a representation of the T4 and T3. They're actually lipophilic. That means they tend to be attracted to fat and they bind proteins once they're in the blood. So you'll see them often bound, not free floating in the blood, to something called thyroxine binding globulin. So less than 0.1% of these hormones are actually found unbound. So for the most part, this particular protein is very important. So whether your levels of this protein are high or low will dictate whether or not you have enough of the free floating hormone around to go ahead and do its function at the end organ, in the peripheral tissues. So thyroid hormones are essentially commanded by the brain, by the hypothalamus. So it's part of this whole endocrine system. And you probably heard me in previous webinars, I talk a lot about the circadian rhythm and how important this is. This is also another hormone that is dictating several different functions in our body that is regulated by the hypothalamus. And it does its job from messaging that's coming from the pituitary gland into the thyroid and then into all peripheral functions in the body. So what are those functions? the heart. So the thyroid hormone is responsible for tachycardia, so that's fast heart rate when your heart is beating really quickly, and increased cardiac output. So it's responsible for all these important functions in the body. It's also important, this is really key, for catabolic functions. So lipolysis, the breakdown of fat, is also an area that the thyroid hormone is responsible for, in addition to bone and nervous system development and other things responsible for the metabolic rate in your body. So that your ability to actually burn calories, right? So to burn fat or to burn the food that you're eating. So one of the first things that I see when there's a slight thyroid dysfunction or thyroid abnormality showing up in the body is that people tend to have difficulty losing weight, or there's a change in your basal metabolic rate where you're not able to lose weight as well or as quickly as you did a couple years ago or 5 years ago or 10 years ago. And sometimes there are important shifts that take place, like you might have had a pregnancy, or you might have gone through a major stress in your life. All of these things can cause an imbalance in your hormonal system, and sometimes can throw your thyroid a little bit off balance, creating a less than optimal range, which then shows up very early as stubborn weight gain, or weight that's very difficult to lose. So remember that thyroid is responsible for that increased metabolic rate and the heat production in the body. So another symptom that you'll often hear about or feel is that you might be feeling cold. So you might be in a room where everybody else seems like they're fine, and you have a big sweater on, or you have a shawl on. Your body is feeling cold all the way through. That's often a sign that your basal metabolic rate isn't functioning optimally, and you're not producing enough heat in your body naturally. Now, we don't want to overheat, and you'll often hear me talk about cooling practices and cooling breath, but also you want to be kind of thermoregulated and balanced at the right amount of heat in your body, and that's really coming in from the thyroid hormone. It's also important because thyroid increases oxygen consumption in these metabolic active tissues. So it helps with detoxification, oxygenation, and the basal metabolic rate. It's essentially modulating your metabolism. So one of the most common things that we see in functional medicine is a condition called hypothyroidism. That means your thyroid is underactive. It's not producing enough thyroid hormone, or the thyroid hormone that it is producing is not as effective downstream at those end tissues that we talked about. So if your thyroid shows some atrophy, that means it's changing its shape, it's reduced in size a little bit, or there's destruction of the actual secretory cells of the thyroid that are being stimulated. This is a syndrome that's essentially called hypothyroidism. And it often is detected because there's a lack of thyrotropin releasing hormone coming out from the hypothalamus, or because the TSH, the thyroid stimulating hormone from the anterior pituitary gland, is affected. Okay, so those are the most common reasons, but there are certainly other downstream effects that can occur that also prevent the active conversion of T4 to T3, and therefore that T3 that's metabolically active and extremely effective in small amounts is not as effective at your body. So how does this show up? What does this show up as in your body? So overall, you'll notice that there is a decrease in metabolic activity, including the lower BMR that we talked about, right? So one of the first signs you'll notice is that you're feeling cold. You're feeling cold at times where other people are fine, they're warm. And that's a lack of the calorogenic effect, the lack of ability to keep that heat. And then there's that tendency to gain weight. Now, I've definitely seen low thyroid function in people who are not gaining weight. So don't think that just because you're thin that you're not likely to have hypothyroidism. That is not necessarily true. However, if you are gaining weight and it's very difficult to lose it, no matter what you're doing, it could be that your thyroid isn't optimal. So you're not burning fuel at a normal rate. Essentially, the gut becomes more sluggish. Okay, so you might notice, and part of our workup is also to treat the gut. You might notice that there's constipation, okay, or you're not going to the bathroom as often. You might also notice that you're easily fatigued. There's lower energy production, and your heart rate and respiratory rate, as well as your blood pressure, can be affected. And one of the other signs is actually lack of alertness. So, especially right now where there's so much stress, this stress actually affects our hormonal system. It's an extremely sensitive system. And so, when you have a lot of stress in your life, you don't have the ability to manage it appropriately or don't have the right outlets, your body is going to get a little bit overwhelmed, and your internal systems also get overwhelmed. And sometimes it shows up as your lack of ability to stay alert, right? To stay focused. Sometimes you might notice you're slowing your speech, or you have less or poor memory showing up. Okay, so those are some of the symptoms that show up with thyroid dysfunction. Physically, you might notice your hair is changing. It might be a little bit more brittle, sparse, and dry. Your voice might change. It could get a little bit slower and huskier. And in more extreme cases, we have something called mixed edema, where there's actually retention of water, and sometimes retaining water with having a carbohydrates in the diet can also be a result of altered metabolism. So those of you who are on low carb keto diets that are noticing a lot of great effects, it's often because of the secondary issue that's going on with the thyroid. And in some cases, it could even be a primary issue with the thyroid. And so if you optimize the thyroid, you might notice that you might be able to tolerate more carbs and have less water retention. So generally, the treatment would be giving you thyroid hormone, and in some cases, iodine. So when it comes to the opposite, we talked about when there's hypofunctioning of a thyroid, when it's not functioning optimally. There's also the overfunction of the thyroid when it's overactive, and that's called hyperthyroidism. The most common cause of that is Graves' disease. This is the thyroid disorder that I think most people know about, with a big goiter that shows up, and basically it's a big mass in the neck area. And that is essentially a major problem sometimes in other parts of the world, not so much in the West, due to the iodine that's there in our diet and lacking in other diets. And remember that there's also this concept of autoimmune disease, where thyroid stimulating immunoglobulin is actually produced erroneously, and that can also produce an overactive thyroid. So you want to always be aware that there are two ends of the spectrum often with endocrine disorders, and there could either be hyper or hypo functioning. And so you want to really make sure you get evaluated properly if this condition seems resonant to you. So what are the symptoms of hyperthyroidism? Just so you're aware, is you'll have the opposite. You have the increased basal metabolic rate, increased body temperature. Your appetite actually increases with a drop in the weight. There's increased digestion, heart rate, respiratory and blood pressure go up. Sometimes people will have a bit of a tremor. So you'll notice that your hands might be tremoring a little bit. You're kind of feeling very agitated, excitable, irritable, and scared. And that's an example of a hyperthyroidism function. Some of the physical signs are exophthalmos, which basically means bulging eyes. Your eyes might be really kind of sticking out more than normal by bulging out. Complex water retention, carbohydrate deposits behind the eye. That's what actually causes the eye protrusion with hyperthyroidism and goiter. So remember, goiter may occur in either hypo or hyperthyroidism, but also is not always present. It's one of those conditions that we want to be aware of, but it's not as common. Now, the more common condition that I see often with people, particularly those who are coming in for support around weight loss, are fatigue, increased sensitivity to cold. So when they're, I mentioned, in a room, you'll find yourself wearing a shawl or wearing a sweater. Constipation is another sign that shows up. Dry skin. Your skin is drier than normal. Another sign of hypothyroidism. Weight gain. So weight gain or difficulty losing weight when you're doing everything that seems right with your diet and your exercise and your weight is not budging. Puffiness in the face, so you'll notice that your face might be looking a little bit more puffy than normal. Hoarseness in the throat, muscular weakness. Sometimes we will see elevated blood cholesterol, and this is a secondary effect of treating the thyroid, is that sometimes will normalize as a result of getting your thyroid back into balance. Muscle aches, tenderness and stiffness, pain and stiffness or swelling in your joints, heavier than normal or regular menstrual periods, thinning of the hair, slowed heart rate, depression, and impaired memory. So if any of these things sound resonant to you, you want to really be aware that the thyroid could be involved. Now, if there is a thyroid imbalance for a prolonged period of time, as I mentioned, if you're suboptimal, less than optimal, and the condition continues, the activity continues in that way for a long period of time with a lot of stress and poor diet, diseases can actually start to manifest. And some of those diseases we've talked about, like goiter, and another one is actually Hashimoto's thyroiditis, which is actually one of the most common causes of a goiter. And this is an autoimmune condition that actually does have a root cause of gut health that's involved. And so you'd want to really work on both the thyroid and the gut at the same time, as well as changing your diet if that's the case. And to address the Hashimoto's, you need to take a look at your thyroid antibodies also. Heart problems, increased risk of heart disease, primarily also because of high levels of LDL cholesterol in people that have an underactive thyroid. So again, a root cause sometimes of an elevated LDL could be the thyroid. Subclinical hypothyroidism, that means mild or early form of hypothyroidism where symptoms have not yet developed. So in other words, when you check your levels, you might see a slight shift in there that is suboptimal, but hasn't fully manifested in full-blown disease. And then mental health issues. So depression can actually occur in hypothyroidism. And there are cases, many cases, where people treat the thyroid and feel much better mentally. And so it's important to take a look at this in a holistic way. Peripheral neuropathy, so long-term uncontrolled hypothyroidism actually starts to damage your nerves peripherally, as well as information that's coming from your brain and spinal cord. And then something called myxedema, which we talked about earlier, which is it's essentially triggered by infection or other stresses in your body, and can be rare, but can also be life-threatening. And it's an emergency condition. So you don't want to ignore this if this is something that's there for a long time or in high abnormal levels. Thyroid is also involved in fertility. Okay, so for some of you that are struggling with fertility, it could be the root cause is not only the blood sugar, which we've talked about, and I've talked to many of my patients about, but also infertility can be caused by the thyroid hormone itself. Okay, because thyroid can interfere with ovulation, which then impairs fertility. And birth defects. So babies born to women with untreated thyroid disease can have a higher risk of birth defect. So what do we need to evaluate when we're looking at your thyroid? And a functional medicine workup for thyroid is quite different from a conventional medicine workup because we are able to work with labs outside of those that are classically covered by insurance. And then we also have the opportunity to really dive deep in our visits and look closely at what the additional things we can do for treatment are. So the main labs you want to check are thyroid stimulating hormone, TSH, free T4, free T3, and reverse T3. In addition to that, if indicated, you'd also want to take a look at your antibodies if Hashimoto's is something that could be of concern. So what are the optimal lab values for thyroid tests? In functional medicine practice, doctors don't often follow the true abnormal values because we instead look for optimal ranges and treat accordingly. Remember, the reference ranges that are created based on conventional lab tests are created for extreme cases of disease, for abnormal cases. But what we're dealing with in functional medicine and health optimization is not extreme cases of disease, but it's of making yourself feel as optimal as possible, as good as possible. And so we need to look within that range at where you were before, what's optimal for you, and how your body is progressing over time. So it really is more of a continuous measure over longer periods of time that's more effective when looking at lab values for hormones, particularly around cases of functional medicine. We don't yet have that available to us in conventional lab testing. And so using a different approach can be very helpful when it comes to a functional, holistic way of looking at your lab results. So I've listed here some of the different ranges that are considered optimal when it comes to the lab values. If you already have a thyroid test, you can look at yours and see if that is where you fit. If you have not been evaluated, you might want to get checked by a functional medicine provider and see if that's where you are falling in the range. Now, what can you do if you do have a thyroid dysfunction or thyroid abnormality? Well, certainly, number one, you want to get evaluated and get treated if the condition is to the point where it necessitates treatment. But also, in addition to that, there are certain high quality multivitamins and supplements that can be effective in supporting the thyroid. And I just wanted to highlight some of those here. Certainly iodine, zinc, selenium, iron, vitamin D, and B vitamins are all supportive of the thyroid gland. Now, the actual amount that you need will be in a higher quantity than you can find in a general multivitamin. And so you really want to work with somebody when you're looking at this, because if you're taking any medications that are actually contraindicating for these actual supplements, you want to have somebody who checks those for you and is able to guide you on those supplements. Also, make sure that your multivitamin contains sufficient levels of iodine, because remember that conversion we talked about from 3T4 to T3 requires that. Now, very important when you're dealing with the thyroid is you want to look at your diet. And you can certainly add some of these supplements in through the diet. Okay, so by focusing on foods that have more quantities of this and including those in your everyday diet, and also think about gluten, because gluten tends to have an inflammatory effect on the system, which tends to aggravate thyroid dysfunction. So going gluten-free can be very beneficial, particularly when you're in the treatment phase of dealing with a thyroid disorder. And last but not least, deal with your stress. I talked earlier about how important stress is and how toxic stress is in causing dysfunction within the entire endocrine system. And you want to support your stress as well as your adrenal function, which also feeds back into part of the thyroid function as well. So the adrenal glands and the thyroid actually work hand in hand. So I often recommend that people work with a yoga therapist and do some restorative yoga, use adaptogenic herbs that are going to actually support the adrenal gland and help you cope with stress when you're working with your thyroid. Make sure you're getting enough sleep. So sleep, we'll talk about sleep in more detail separately in a different webinar, but sleep is one of the most critical things that you want to restore first when it comes to thinking about your health. So before you try to push those hours in the gym, try to push those hours in the bed and make sure that you're getting enough sleep at night. This is where your body is detoxifying and restoring, giving yourself then the ability to have more optimal function with all these hormones and throughout the day. Helps you with anti-aging and all other functions in the body. So have a very careful look at how well you are sleeping. What does your bedroom look like? How much are you disconnecting from electronics before you go to bed? All of this is critical. And the next thing is dental amalgams. So for those of you who have had fillings in the past where they were still using mercury in the fillings, you want to be aware that heavy metals do often cause thyroid dysfunction and cause other endocrine dysfunctions in the body. Okay, the thyroid gland is extremely sensitive to heavy metals. So making sure that you are working with a biological dentist, somebody who understands toxicity from mercury to support your needs around your dentistry can be very helpful. Now you want to also do some very active detoxification if you are going to have them removed. But work with somebody who's familiar with this. Don't just go at this on your own. Next, you want to make sure that you're eating good vegetables and cruciferous vegetables. There is a bit of a debate on the fact that this might worsen thyroid disorder. In general, if you're going to cook and eat a moderate amount of crucifers, they should not affect your thyroid negatively unless you're extremely sensitive further down the line. So having a good balanced diet will be helpful with a moderate amount of cooked cruciferous vegetables. Get fluoride, bromine, and chlorine out of your diet and your environment. Again, I talk a lot about toxicity, but this, again, is an area that the thyroid is very sensitive to. So making sure that you are conscious of where you find these things and how to remove them from your body. And very important, heal your gut. We talked earlier about how important the digestive system is, the adrenal system when it comes to the thyroid, making sure that you have a good barrier in your gut lining, that you don't have intestinal permeability, that your bowel functions are working well. These are all very important signs of a healthy, active thyroid. And so you want to make sure that all of that is taken care of when you're evaluating working with your thyroid. So for those of you who are wanting to learn more about your thyroid function, maybe some of these things resonate with you and you think you might need some extra support. If you're a resident of California, I encourage you to go ahead and take a look at the website, mimansa.co. I've posted a link. You can just click on the link and there's a very easy sign up process to be seen and evaluated for your thyroid for residents of California. If you are not a resident of California, but you're interested in more information or being supported, go ahead and fill out the form link that's also available, where I'd like to know where you are residing and what your particular needs are, and love to support you in whatever way I can. So I hope you enjoyed this education seminar on thyroid dysfunction. It was a lot of information, and I think sometimes it can be overwhelming when you listen to this for the first time. So take your time, walk through this content. There's a lot here. There's a lot that you can do to support your thyroid health, support your own health, and reach out if you have any questions. I look forward to hearing from you, and I hope you have a lovely day.